Hi viewers, and welcome back to another episode of Sessions with Koren. Last week we had such a wonderful time. We spoke about physical and mental decluttering and the use of colors, music and scents to enhance our environment. And the feedback from you was so fantastic. Some of you shared about your favorite scents. I remember someone mentioned lavender for resting. You spoke about what colors you loved and how meditation has helped you with mental clarity and so much more. It was a joy hearing from you all, and I look forward to your messages. Please continue to post your comments on our Facebook and our YouTube pages. We so look forward to hearing from you. I want to thank you for tuning in today. Our focus in this episode is about a condition that affects millions of adults worldwide, but it often goes undiscussed. That is adult deficit hyperactivity disorder, or as we commonly call it, ADHD. Of course, we've talked about ADHD in children, but adults also are silent sufferers. In the course of my work in Antigua and Barbuda and elsewhere, I have met so many adults who have this condition. ADHD affects how we think, how we function, and how we work. It affects our relationships and our daily life. So today, I want us to really unpack this issue and to provide you with some coping mechanisms. Our expert guest will help us to figure out, how do we know when we have the condition? How do you support someone else who has ADHD? And what are some practical strategies for managing it in ourselves at home and at work? Stay tuned, and we will be right back after the break. Now, on the couch is Dr. Jerry Simon, physician and addiction specialist. I also happen to know that he loves cricket very much, but we're not talking about cricket today. Dr. Simon, I'm so happy to have you here with us to talk about adult ADHD. Welcome.
Thanks very much.
How are you doing today?
I'm okay, just a bit back and forth, but hey, I'm fine.
Okay, great.
When I move, I feel good.
All right. So the first question I have for you, and I'm sure our viewers have the same question first. What exactly is adult ADHD, and how do you diagnose it?
Well, ADHD is attention deficit hyperactivity disorder. It's a condition that's often diagnosed in children. But as I said before, at some point in time, adults do grow up to be children. Children do grow up to be adults.
Yes.
And it doesn't mean that the condition they have as children just disappear. So, attention deficit hyperactivity disorder is a condition in which a person suffers from 3 sets of symptoms. Mm-hmm. Number 1 is the hyperactivity, and we all know what hyperactivity is. That child that just can't keep still. Secondly, they also have what we call attention deficit or inattention. And the third set of symptoms are what we call impulsivity. That is, you're very impulsive, you can't wait your turn, you're always shooting in, that kind of thing. And it's the same in adults and children in the sense that the condition is the same, but it manifests itself differently. For example, in children, often we can see it. We see the child, especially after 8 years old, because when a child is like below 6 years old, you know, they're going to have their little impulsivity, their attention deficit, things like that. That's normal for a child. However, as they get to 7, 8 years old, they should be able to sit still on order in class, things like that. And so we see children who have attention deficit hyperactive disorder, and you cannot tell that they do. With adults now, it can be more subtle, but even more devastating. Because in adults now, it means they have difficulty in terms of focusing on their work, organization, keeping time, and those kind of things are very important in terms of adult responsibilities.
Yes.
And as a result, although it's the same condition, it's the same underlying kind of condition in terms of its cause. You know, we think a lot of it is genetics, although environment may also play a role. For example, mothers who ingest certain toxic substance, it is believed that they can affect the fetus and lead to ADHD. However, the manifestations, like I said, in adults, though subtle, though not always seen, can be just as devastating and even more difficult.
Yes, yes, absolutely. What about when someone is at work? The boss is saying you have these deadlines, these are your priorities, these are the things I expect from you. And this adult, undiagnosed, because a lot of the times we don't necessarily know what's wrong with us, we just know there's something not right. How does it manifest itself at a person's workplace?
The thing about it, people with ADHD are often very creative. And if we, at some point in time, we talk about the advantages of having ADHD, if there's any, they can be very creative people. So they get good jobs. Believe it or not, they tend to do well in school as well, even though sometimes it can hamper them in school. They find the children sometimes find their ways and means of coping with it, and they do well in school. However, when you get to be an adult, like I said, the problems still persist.
Yes.
So you find that person is not making deadlines. That person is not even getting to work on time for no reason whatsoever. They wake up early, they're ready to go early, but for whatever reason, they just don't arrive to work on time. They're not finishing projects on time. They're not organizing their workspace. The desk is always cluttered, and they will tell you, hey, I function in my clutter, but sometimes it's very difficult to function in that clutter, especially when you have to deal with other people. So as a result, it can be a devastating and difficult condition when you have certain jobs. Okay, so when you see a person who's very creative, who knows their job well, not because they don't know the job well, but they just, and there's a word I always use when it comes to ADHD, it's called procrastination. People with ADHD just procrastinate not because they can't do it, but for some reason, they find it so difficult to just sit down and do some task that, especially tasks that they don't necessarily like that much, and they find they just can't get themselves up to do it. However, when they do finally get themselves to do it, they can get it done quickly, and most times or sometimes get it done very well.
Yes, yes, yes. And so for our employers really need to understand, when you have certain staff members who are they might be brilliant, they might be good at certain things, but you notice their issues with timing, how they get work done, the time in which they get projects done, then maybe instead of just penalizing that person, you need to pause and consider, does this employee have adult ADHD? Dr. Simon, what are some tips for them though? Because if you're at work with this issue, based on what you said, I can imagine that some of our viewers who are suffering with adult ADHD, sometimes they get to work, and because they have 15 things to do, they just can't get started because 15 things crowd in your mind all at once. So you have like the sort of analysis paralysis. Okay, I need to do these 15. Where do I start? What are some tips to help them with productivity, bearing their condition in mind?
Well, you make a good point earlier when you said that employers need to understand their workers. Because I see sometimes it can be used as an advantage in the sense that, okay, let's give you a cricket analogy. If you have to make...
I knew the cricket had to come in.
If you have to make maybe 400 runs in 150 overs in a test match, like you're chasing 400 runs to win a match, you might have somebody like Shivnari Chandapal and Jack Callis to start out your innings for you.
Yes.
However, let's say you have to get 80 runs in 10 overs. You'll have somebody like Shaida Freedy.
Okay.
Because you know that's the kind of guy who will get that for you.
Yes.
The same thing with ADHD. if somebody gonna come to, let's say, have an interview about your company, and you know, boy, Jerry knows about this company, but he only have 5 minutes to prepare. I mean, Jerry's the person to give that.
Yes.
As opposed to maybe tell him 2 weeks in advance that he has to do that. He might put it off until the last moment the same way.
Okay.
So you have to understand what are the strengths and weaknesses of your workers. In terms of the person with ADHD now, what they need to do, you need yourself to get organized. Establish a routine.
Yes.
Don't be afraid to get a diary and write in a diary. But sometimes even when you do that, I have patients with ADHD who come to me crying and tell me, Dr. Simon, I buy 3 or 4 diaries and I still can't get myself organized. So you have to start early o'clock. Don't wait until the 1st of January to plan for the 1st of January, to plan for a new year. Start planning since October last year. Because you need to get your routine early, know what you have to do each day, write it down so they're reminders. Another thing, have reminders. They can be color-coded reminders. Nowadays, everybody have a phone, a smartwatch, a smartphone, something that can give them a little thing, a ping, something like that. So put it on your phone when it's time for you to do something. Ask people to remind you as well.
Yes.
Get people to give you a call. Hey, call me at this point in time. Send me a message at this point in time to remind me. You know, not that you're dependent on other people, but you also sometimes needs to get a little reminder from someone else. Create a dedicated workspace.
Okay.
It's important to have your workspace declutter, because that cluttered workspace sometimes clutter your brain. And people with ADHD, the last thing you want is your brain cluttered. You need that brain firing on all octane, so to speak.
Yes.
So declutter your space. Use focus tools. I often tell people that classical music and things like going to the beach and watching the waves, now it might seem useless, but let's say you sit on the beach for an hour and just watch the waves as they come in and out. There are a lot of things you'll notice in that hour that the average person is not going to notice. So a person with ADHD now will be forced to focus. The same thing with classical music. I often tell patients with ADHD, hey, listen to classical music for at least 1 hour. And listen to something like Mozart that have all these runs and ups and downs, and I know the musical terms to them, shafts and flats and whatever. So you can then have to actually listen to the music.
Yes.
When you have that routine, it helps you to focus.
Yes.
Take breaks. Sometimes people with ADHD don't give themselves breaks. And as a result, they find themselves behind the 8 barrel all the time, and it's always going. They need to take break again to declutter, de-stress, to calm down, and then they can move again.
Yes.
You know, and seek support.
Yes.
You're not the only person in the world with ADHD. It's impossible. In fact, studies show that between 2 and 5% of adults in the world have ADHD.
Wow.
Quite often it's undiagnosed or it's self-diagnosed, because people know. When you have ADHD, you know.
Yes.
You might not know the term, but you know.
Okay.
And people might think you're lazy, you just procrastinate, you're not dedicated, you're not organized. But sometimes they don't understand what a person with ADHD goes through. It's often very difficult. You look at the work on your desk and you see it, you know it, you can do it, but you can't just get yourself up to do it.
Yes.
And then it becomes overwhelming, and then things like anxiety, depression, work insatisfaction, you get grumpy, things like that happen. So it's important to get support from people like-minded that maybe have ADHD as well.
Yes.
And ask them, hey, what do you do to cope? How can we help each other? That's very important.
Absolutely. That was quite a lot. That's really important. I think I have adult ADHD.
Join the club.
And I understand so much of what you're saying. Like, I have to make lists, and those breaks are really, really important. And so when you work sometimes with other people and they can sit focused for 3 hours, the back of your mind is just, you're going through all the things you have to do. So you're sitting in church and you're thinking, what am I going to cook for lunch when I get home?
Mind you, somebody with ADHD can focus for long hours as well too.
Yes.
Again, and that's what I'm saying, you have to understand yourself.
Yes.
And the people you work with have to understand you. Rather than penalize a person for not being the person who's going to get a particular deadline or whatever, give them the task that they can use. For example, when I worked at a hospital, I also get the graveyard shift, they call it.
Yeah, graveyard.
Because when everybody else is tired and everybody else can't focus, that was my time to click in.
Wow,
when
that's after midnight.
When the sun set after midnight, down that kind of time, when people are tired, that's the time I click in. So I'm saying, use me at that time.
Yes.
When Just use people or find ways and means to get the best out of your worker.
Yes.
Because a person should not, hey, again, people look at people with ADHD and say, oh, y'all just find an excuse for not doing what you're supposed to do in the time you're supposed to do it.
Yeah.
If you really understand what people with ADHD go through. I remember doing a program on my, I read a program some time ago on the Wellness Corner. And a lady called me during the program to speak to me after. And for about 2 hours straight after the program, she talked to me.
Wow.
And most of the time she was just in tears.
Wow.
And she tell you all the things that she did to try to overcome ADHD and just couldn't.
Wow. Wow. I can imagine, and I'm sure some of our viewers go through that also. It's not easy. Maybe one of these days they will show us the brain of somebody with ADHD, and we'll probably see a lot of neurons going off and a lot of colors and figures. So work, make your list, have your routines, take your breaks, write a list, set timers, have support. What about at home, and in the relationships?
The thing about ADHD, it affects every sphere of your life.
Okay.
It affects you. In fact, by definition, that's basically the definition. Because if it only affects you at work, then it might not be ADHD. You might just don't want to work, or might just love the work, or it might even be burnt out.
Yes,
because sometimes people can get burnt out from their work.
That's a good point.
So it affects your work life, it affects your home life, it affects your relationships. And quite often, people with ADHD, because again, the deadline issue, they might not remember birthdays, they might not remember to bring the flowers, they're having their mind to do it, or they might even remember the birthdays and stuff, because I don't ever forget birthdays. But you have it in mind to get the flowers, but for whatever reason, you just don't go and get it.
Yes.
And then you get cussed out. So it's not easy in all sphere of life. And then, as I said, because of the complications that you get, quite often what happens, people now will get depressed, they get anxious because they're not understood. And it can have implications for your general health, for your physical general health and for your mental health otherwise as well. So if you have ADHD, it's important to get checked for it.
Okay.
There's a set of criteria, and we can talk about the diagnosis a little bit. There's a set of criteria the doctor will use, and these criteria based on the things I mentioned before.
Yes.
Is this person showing signs of inattention?
Yes.
Are they showing signs of hyperactivity? Are they showing signs of impulsivity? And is it disrupting their life to the extent that it is becoming a problem, whether it be the work, home life, school, if they're in school, whatever sphere of life, is it affecting it negatively? And those are criteria you use. I mean, the DSM-5, which is the Diagnostic Manual for Psychiatry, they have their little points that a doctor can use. And you often give the patient a questionnaire.
Okay.
And observe them, ask them questions. And you can definitely tell that this person is most likely suffering from ADHD.
ADHD. Okay, so you would advise our viewers, if you feel like these things have been happening to you,
get help.
If something sounds familiar based on what Dr. Simon has mentioned, check with your primary physician to start. If you have access to a psychologist, a psychiatrist, feel free to speak with one of these experts. I know a lot of us love to go on Google and check things out, but it's important that you speak with someone, especially who has some medical training, because they may need to rule out some other things.
Yeah.
Is there any positive side to ADHD?
Yeah, I think so. The first place, people with ADHD are generally very creative.
Okay, creativity.
They tend to see things that other people don't see. They tend to think outside the box.
Yes.
For example, sometimes I go places and look at something and people are, for example, in a meeting and having a discussion and I'm saying, but the answer is so obvious. And they tend to always kind of defer to you. But don't ask me to implement it. Ask somebody else to.
Yes.
My job is to tell you the answer.
Okay, okay.
But yeah, people with ADHD tend to see things a little differently. And their brain sometimes work very fast when other people might be sputtering on something. So there's the advantage in that sense. They tend to be energetic and enthusiastic as well too. Okay. The person with ADHD tend to be the one that has the energy and tend to be enthusiastic to some extent.
Yes.
And especially at the time when other people get tired, they sometimes have that kind of latent energy that nobody else has. And like I said, the spontaneity as well. I mentioned earlier, if you have to score 400 runs, you might want Shonda Paul or Jack Callis. but you have a Freedy if you want to get, or Andrew Russell if you want to get that runs quickly.
Yes.
Because that's their ability.
Yes.
The same thing in your workplace. If you have somebody with ADHD and you need something done right away, something that an emergency comes up, something that you didn't necessarily plan for, the person with ADHD is likely to be the one to go out and get that done.
Okay.
And you think they had a whole year to plan it the way they get it done.
Okay.
So there's some advantages to it. Problem solving skills. They tend to be able to solve problems a lot. Unfortunately, we can't solve our old problems at times. But problems are just in the moment where everybody's sitting down and scratching their head.
Yes.
Hey, we tend to see it a little differently and can be able to say, hey, this is the answer right here.
That makes a lot of sense. So those ADHD persons are probably the ones who are in the sprint and they're not in the marathon.
Exactly.
Because if you put them in the marathon, halfway through they'll be distracted by something. But short, quick bursts of energy and they get things done. And I like the idea of the ideas. I feel persons with ADHD come up with a lot of bright, quick ideas. Like you said, the implementation might not be their thing, but you put them in a think tank and you get a lot of ideas flowing.
And you see, a person with ADHD as well, you have to give them a job, or they have to get a job where something that always piques their interest. Sometimes a person is intelligent in school and they do well in school and think, oh, be a doctor, be a lawyer, be an engineer, be an architect. Those jobs might not necessarily be the best job for somebody with ADHD unless they get the help and training to deal with it. And of course, they can do it. I mean, if you get the help and training, you can do it. However, try to find out what is their interest.
Okay.
Because someone with ADHD can sit and focus on something for a long period of time, something that they love and they enjoy.
Okay, great. Yes, that's important. That is important. If you're interested in something, you're able to spend time with it. So I just want to ask you one last thing. I want to know, if I'm living with someone with ADHD, how do I support them or get treatment for them?
The important thing is to get treatment.
Okay.
I don't necessarily like people self-diagnosing, although we all have this a certain level of self-diagnosis. Well, self-treatment, I should say. Okay, if you diagnose yourself, so to speak, you can then go to a physician and then the physician can make the definitive diagnosis.
Yes.
And like I said, go to a primary physician first, a primary care physician, because it might not be something primarily psychiatric. You might have some other issue that's not ADHD that could manifest itself as such.
Okay.
So it's very important to get help from your primary care physician. And then they can refer you to the person who can help you. It might be a psychologist, it might be a psychiatrist, it might be someone who's versed in the treatment of ADHD. I'm not a psychiatrist, but as an addiction specialist, I've seen so many patients with ADHD.
Yes.
So because, again, one of the problems with a person with ADHD, they tend at times to find mechanisms of coping. And one of the things that they do is sometimes take illicit drugs or self-medicate to cope. They often take stimulants. Stimulants are the treatment, first-line treatment for ADHD. Things like Adderall, Concerta. A person with addictive personalities, you might want to give them something that's not addictive.
Yes.
And they have non-addictive medications as well.
Yes.
But there's so many things you can do. And some things that you do in terms of things like what we call cognitive behavioral therapy.
Yes.
We can have the person visualize things and learn to handle things. Support groups. Exercises, physical activity, eating well, organizing your day, getting that diary and learn how to use your diary properly.
Yes.
So you can organize your day.
Yes.
So these are things that we can do to help people with ADHD. But if you live with somebody with ADHD or you live with someone and you notice those symptoms that we spoke about, it's important for you to get help. Because that person can have a very disruptive life, a difficult life, because they're suffering from undiagnosed adult ADHD.
Dr. Simon, you have given us so much food for thought. Thank you very, very much for your expertise and the little cricket.
The cricket analogy, right?
The cricket analogy, yes, that's helpful. Viewers, you have heard from Dr. Simon what to do if you're having adult ADHD or think you have it. We will go into a checklist later for you to figure out if you feel like this is you. And you also should speak with your medical doctor, your psychologist, your psychiatrist. At this time, we will go for a break and we'll be right back. Viewers, welcome back. It was such a pleasure listening to Dr. Simon and his explanations. How do you know that you have ADHD? Recognizing adult ADHD is not an admission of weakness. It's a courageous acknowledgement of your truth. It's understanding that the hurdles you face are not insurmountable mountains, but rather stepping stones on your path to growth and self-discovery. Embrace that fact, seek help if you need to, and understand that knowing and treating your condition is a powerful act of self-love. Let's look at a diagram. Go through this with me and see which ones apply to you. How do I know if I have ADHD? If only you would apply yourself, you feel like you achieve less than your peers despite working just as much. You often get stuck and can't start anything, sometimes even fun things. What if I'm just lazy? You spend a lot of time trying to figure out why you're so different. You only have 2 time settings, now and not now. The latter meaning it's probably already 10 minutes past the deadline. You often catch yourself having spent an entire day concentrating, forgetting to even eat or drink. Why didn't you just? You ask yourself this question, and you've heard this question more times than you can count, but you haven't found the answer as yet. You often feel like people are too slow to follow your thinking. You often react more emotional than your peers and have a hard time calming yourself down. Boredom gives you this torturous itch in your brain that nothing can satisfy. You feel like you're playing life on the highest difficulty level. You can't rely on your memory, and it feels like it's getting worse and worse. You can concentrate and think better when you do something with your hands. You have problems sticking to goals and routines, even if they're important to you. You often find yourself addicted to stimuli like snacking, scrolling on your phone, and listening to music. You have problems deciding what to do, in which order, or where to start, and end up doing nothing. You are not alone. If you feel like you have this condition, you are not alone. Let this be the beginning of a journey where you celebrate your strengths and understand that the beauty of who you are transcends any perceived limitations. Reach out if you need help. Time now for your golden nugget. If you can't fly, then run. If you can't run, then walk. If you can't walk, then crawl. But whatever you do, you have to keep moving. And that's a quote from Martin Luther King. Don't compare yourself with anyone. Do the best that you can to grow, regardless of your personal abilities and at your own pace. Viewers, it has been a pleasure spending time with you. Check out our past episodes on YouTube, send in your questions and comments, and I look forward to seeing you next week. Thanks for watching.